Back pain. Stretching would induce a reduction in pain for people with low back pain. Researchers recommend frequent stretching. This practice would help manage pain by reducing their sensitivity to it. Ultimately, this would promote the resumption of appropriate physical activity, the first recommended treatment. In 90% of cases, back pain and low back pain heals in less than 4 to 6 weeks. But if the pain exceeds 12 weeks, the back pain becomes chronic. Even when this is the case, it is not and should not be inevitable. As Medicare explains, the cause of back pain is very often sedentary lifestyle or lack of activity. The muscles relax, are not strong enough to play their role, and lower back pain occurs. This is why it is recommended to maintain or quickly resume physical activity. Becauseit is by maintaining his backend, by strengthening his muscles and the flexibility of the ligaments, that the patient heals. In addition to the practice of an adapted physical activity, the body also recommends regular practice of flexibility and stretching exercises. Here is a study, published in the Scandinavian Journal of Pain by a team from Laval University and McGill University, suggests that passive and prolonged stretching of the back could reduce pain sensitivity. If these results are confirmed in patients suffering from chronic back pain, this intervention could become a tool in the fight against lower back pain, also called lumbago. For the purposes of their study, the researchers recruited 22 patients without back pain. Higher tolerance in the lower back. The participants underwent a test to measure their threshold of pain sensitivity in the muscles of the lower back and forearm. Using an algometer, we gradually increase the pressure exerted on the muscle until the pain threshold is reached, attests the head of the study, Professor Hugo Masolari. Subsequently, the subjects performed a back muscle stretching session. For 3 minutes, they had to lie in a supine position with their legs folded over their chest. A foam roller placed under the sacrum and a strap around their thighs kept the position in place, minimizing muscle contractions. In general, after 30 seconds, the stretching does not provide any additional benefit for muscle flexibility. On the other hand, as we are interested for pain sensitivity, we used a sufficiently long duration to create discomfort in the subjects, adds the researcher. The scientists then retested the participants with the algometer. Results: the back of the stretches have significantly increased the threshold of sensitivity to pain. According to Prof. Masolari, this higher tolerance was noted in the lower back, but also in the forearm. The effect appears to be systemic, as if the stretching caused a reaction in the central nervous system. Assistance in the practice of rehabilitation exercises. The researchers want to be cautious, stating that the clinical repercussions of these results need to be specified, in particular because it should not be forgotten that pain caused is different from spontaneous pain. But they want to confirm the effectiveness of stretching to raise the pain tolerance threshold by calling on people with back pain. If successful, this practice could be used for 2 purposes. Stretching could help patients manage their pain in the short term. Moreover, as their tolerance to pain would be greater, they would be less afraid of doing the recommended rehabilitation exercises, concludes Professor Masolari. Please like, share, comment and subscribe. Thank you.